Shout if you can. Were you talking, I'm sorry, I am having trouble hearing at the back. You were talking about HIPAA rules? And you know, most people, including most people in nursing homes, do not have a formal adjudicated proxy decision maker, living will, any of that stuff. They typically have a joint power of attorney with a family member if they have an involved family member. I'm not quite sure if you're getting at you can't implement anything without the permission of family members. If a person is compos mentis and they're their own decision maker, you actually don't have to engage family members. I think prudent providers do. They try to. They're always worried about somebody coming out of the woodwork at the last minute, a nephew or somebody who doesn't agree with what was done. I guess, I wish I had heard what you were saying, really, and I would need you with a hand mic sort of illustrating the kind of case you mean, because I don't think the providers are that paralyzed. There are some people who land up in the long-term support service system or non-service system and nobody knows anything about them. There are people who've been living in single occupancy hotels, they've been living in houses with lots of cats, and it becomes detective work to figure out as much as you can about them, and that's a whole other kind of problem. I think HIPAA causes problems for human beings, and it certainly causes problems in the nursing home arena, and it caused me problems when I was trying just to pick up my husband's medications after he had both his hips replaced, and they didn't want to give them to me. You know, so I do understand that we have to work around HIPAA problems, but I think we can. If somebody else heard her better, shout out what the issue is. Does any of this make sense for Montana? I mean, you're sort of working at the level of developing services at the same time as you are working at doing the best possible job you can do as nurses, as clinicians in various settings, but. And it is hard to be working both pieces at the same time. Yes.
Do you have any experience working with very rural communities that are far from various services?
Do I have any experience working with very rural communities that are far from the areas of service? Well, I do have some, and I've been paying attention to what those experiences are, and it is obviously very hard. The various rural health centers around the country are paying a lot of attention right now to the supply of different kinds of health professionals. There may be no PTs, no OTs, no psychiatrists, for several counties, and so it is hard to organize things. I would say that if the community is small, not populous, far from population centers, and they're looking for a good long-term care program for an individual, if they're looking for residential programs, that is somebody actually leaving their own home and moving somewhere else. The smaller the better. The small group homes, sometimes called adult foster homes, seem to work better because, just for the market. Sometimes what you could organize in as a practical kind of assistance, there's a very rural community in Minnesota where one nursing home, which is really a big multi-purpose long-term care organization, somewhat like St. John's, but this is in a town of about 2,000 people, and then they have the outlying area. So this long-term care retirement community also has other innovative programs that involve school bus drivers, doing other kinds of roles with families on their route. And it involves some rather complicated systems. It involves training meal deliverers to do some additional things. And all of this is trying to be flexible and use the resources well in the rural community. And this one agency does a huge amount of things. So I guess flexibility is the key, and creativity. Sometimes people in rural areas do very well because if they have some vestige of a local support system. Yeah.
I'm cutting Dr. Rosalie's discussion off now. If anybody has questions that they would like to ask her later on today, she is available, and she has been excellent. So I want everybody to give Dr.